All right, we're starting in with communicating with the healthcare team. I hope I can get this done quick because I'm trying to get it done before the bell rings. Um, Health team members communicate with each other to give coordinated and effective care. As we've been doing our skills, we will say at the end, we're going to wash our hands and we're going to report and record observations. How do you know what to report? How do you know what to record? That's what the communications part comes in. They share information about what was done to the person, what needs to be done for the person, and the person's response to treatment. Communication is the exchange of information. For good communication, use words that mean the same thing to you and the receiver of the message. If I am telling you that I am going to move you into, I'm going to come to your bed and I'm going to have you help me move you to the side so that your feet touch the ground so that we're sitting straight up. I don't tell you, hey, I'm coming here to help you dangle, because that means nothing to our patient. We describe it in words they understand. Be brief and concise. Give information in a logical and orderly manner, and give facts and be specific. This is very relevant when you're speaking with doctors. When I had to call a doctor and wake them up at 3 o'clock in the morning, they didn't want me to be ill prepared. I usually had a bullet point list of what I was telling them and got down to specifics and made sure I didn't forget anything and had to call them back, because it could cause for them to be very irritated with you. There's a medical record. You know it is a chart, maybe a clinical record. They talk more about charts. That's what you see on TV and stuff. But nowadays we've got iPads, we've got electronic records. You'll usually see those in the hospitals now. We've pretty much gone electrical. Electrical? Anyway. A written record of a person's condition in response to treatment and care. A permanent legal document. The nursing center policies about medical records and who can see them address. Who's going to record it, when to record, the abbreviations that you would use in there, how you correct errors, what ink color you should use, and how you sign entries. Let me see what the next sheet shows you. That's a copy of a very old medical record. That's charts. I usually saw those as I worked. I'm going to go back. So sorry. So when it says who records, if I am your nurse that night, I'm allowed to record on there. Okay. As a CNA, you will not be allowed to record directly onto a chart in order, but you can record things such as intake and output and procedures that were done, such as moving from one position to another. You have to record it on your shift. If I'm working an 8-hour shift and I report it in at 7 a.m. and I leave at 3 p.m., I don't go home and chart on a computer from somewhere else. I have to record it within a certain amount of time. The doctors need the information. It's very relevant, the time-wise of it. Abbreviations, we've started to study some of these. You saw QID for 4 times a day, TID for 3 times a day. Instead of saying I'm going to raise the head of bed, I put HOB at 45 degrees. I don't put Fowler's. I just, put the exact degree. Let's say I make a mistake. I have to write in my chart in ink. I think the next slides will show you how to correct that, but I don't use whiteout. You'll hear me say, as a good nurse, I never use whiteout. You mark through it, you initial it. The ink color needs to be black. And some places might take blue, prevalently black, and you can't use like red or turquoise or purple or something cute. And you must sign off on your entries. I would put M.ABMA, RN, BSN, put all my credentials. So, all right. You have an ethical and legal duty to keep the person's information confidential. I cannot go on the elevator and see another nurse and she says, how's baby Smith doing? And me talk on the elevator about baby Smith. Even though that nurse is being nice and genuinely concerned and is taking care of that patient, we're not allowed to talk names, and we're not allowed to talk in public places about it. You'll hear me talk about one of my best friends is a nurse practitioner, and she sees a lot of kids that I know. We are very careful. Oh, there goes the lights again. We are very careful about not sharing information. Um, we understand that we're ethically and legally bound. Under OBRA, residents have the right to the information in their medical records. So you can't be charting something about me and not show it to me. If I want to know, as a family member, if my father gets hospitalized, which he has been, I told my dad to go ahead and sign off so that we could get his records so that I could look at him. He's down in Tennessee. I can't be there all the time, and I wanted to see what was happening with his condition. So I had the right to that. He does. These forms relate to your work. So there's an admission sheet, progress notes, activities of daily living, ADL flow sheet, and other flow sheets. Also, the Cardex is a type of card file. There you go. It summarizes information found in the medical record. When I was in nursing school and we would start our clinicals, they always gave us a Cardex, and it gave us a generalized list of everything in the medical record so we know how to progress with our patient for the day. It would tell us their age, their name, what their condition was, and what their estimated date of leaving us was going to be, when they had been admitted. This shows you activities of daily living flow sheet. This is hard for you to see, but I have a chart out there and I'll be showing these to you. It's where I am showing the different things that we're doing as far as getting them up and walking them and turning them and feeding them and different things. Here we go, sorry.
Glibbery, please dial 8169. Mr. Glibbery, please dial 8169.
Shouldn't do this at school, right? All right. Resident care conferences. OBRA requires two types of resident care conferences: interdisciplinary care planning conference and problem-focused conference. The person has the right to take part in these planning conferences. So the nurse, the doctor, the patient, they all sit down. Everybody, that interdisciplinary can affect them. If I had a hip replacement, the physical therapist might be there. Whenever I did that externship and we were fitting somebody for a wheelchair, it was the doctor, it was the nurse, it was the home health care aide, it was the physical therapy department. All these people that together helped decide what would be the best plan of care for the patient. Again, problem-focused conference, it can be both of those together. That was a problem. His wheelchair wasn't right. He needed a new one. Let's fix it. Reporting and recording. Reporting is the oral account of care and observations. At the end of every shift, the new nurse that was coming on and I sat down. She was taking my caseload. I would go through and give her an oral report of everything that had occurred on my shift, so it helped for what we call continuity of care, that she wasn't starting from square one. Recording is the written account of care and observations. So I report off to a nurse, or the doctor might come in and speak with me, just depending on how precarious or the condition of the patient is. But I put it in a chart so that it can be looked up at any point. Maybe I need to see that there's been a pattern. Maybe their blood pressure has been elevated slightly for 4 days, but it's always at a certain time of day, and then it drops out at another time of day. Maybe we start to see a pattern that can be seen through charting. During end of shift report, which I just talked about, there you go, information is shared about the care given, the care that must be given, and the person's condition. Anyone who reads your charting should know what you observed, what you did, and the person's response. We will be learning how to chart because it is very specific. You need to use very objective words, and you need to use concrete specifics and no supposition. There's no, well, I kind of think that maybe. No, that didn't happen. This is an example of charting. At 0900, we know that is 9 a.m. in the morning. On the date of 320, in bed, complains of headache. The temperature was 98.4 orally. Radial pulse 72 and regular. Respirations 18 and unlabored. Blood pressure was 134 over 84. left arm lying down. Alice Jones, RN, notified of resident complaint and vital signs by Ann Adams, CNA. To the point. You know every place that all of the vital signs were taken, that everything was done appropriately, and that she was notified by the CNA because there was complaints of a headache and we wanted to see what was wrong. There was more examples of charting. 11:45, again, that's an AM. Refused to go to the dining room for lunch. Complains of nausea. Denies abdominal pain. Has not had any emesis. Emesis is what? Vomiting. Abdomen soft to palpation. Palpate means to feel. Good bowel sounds. Vital signs taken. VS. There she made a mistake. She crossed through it. Mistaken entry. 410 PJ. 99.2 was the temperature, pulse 76, regular rate and rhythm, respirations 18 and unlabored, blood pressure 134 over 84. Says she will try to eat something. Full liquid room tray ordered. Paula Jones, RN. We understand about a recording time in military time. This is the military clock, so you can come back to this if you need to. Medical terminology. Prefixes, roots, and suffixes. You guys take a whole med term class, don't you? There you go. This shows you the abdomen is divided into the following regions. Oh gosh, can I show you my abdomen here? Right upper quadrant, left upper quadrant, right lower quadrant, left lower quadrant. Was it my right? It was, because you guys are out there going, that's the left. Remember, it's on the patient, not yours, on the patient. This shows you it divided into the A, B, C, D. Directional terms. Anterior is in front of. Distal, the farthest part from the center or point of attachment. My fingers are distal to my shoulder, right? This is the point of attachment. That's the furthest distance. Lateral, away from the midline, at the side of the body. Medial, at or near the middle of the body. Posterior, dorsal, think of a dorsal fin on a dolphin, at or toward the back of the body. And proximal, the nearest part to the center or the point of origin. My elbow is proximal to my shoulder. This shows you more of those. Abbreviations, we only use those accepted by the center. Computers in healthcare, they collect, send, record, and store information. They save a lot of time. Now they have bedside computers. They increase quality care and safety. Fewer errors are made in recording, and it makes us more efficient. Our phone communications, good communication skills are needed when answering phones. Be professional and courteous, practice good work ethics, and follow the center's policy. You'll hear me talk about phone communications in that you have to be careful about who you're speaking with. Sometimes we add code words in order to give out personal information about patients. And you have to remember that what we sound like to that person that's out there calling about their family member, very concerned, very distressed, and how we need to communicate effectively and provide reassurance. Dealing with conflict, you'll deal with it a lot. If problems are not worked out, the following can occur. There can be unkind words or actions. The work setting can become unpleasant, and care is affected. So we go into the problem-solving process. Define the problem, collect information, identify possible solutions, select the best solutions, carry out the solution, evaluate the results. That all makes sense. The guidelines to help you deal with conflict. Get your supervisor involved and talk to them. Talk to the person you're having the conflict with. Talk in private. Explain, listen. You can read all this on your own. It's how we deal with conflict in real life, but just understand that in a workplace, we have to deal with it professionally, right? We can't go meet in the parking lot and haul it out. And quality of life. Health team members must communicate with each other for effective and coordinated care. False or incomplete information can harm the person. Resident information is personal and confidential. Always protect the right to privacy. The end.